Dr. Josh Luke here with the Health Wealth podcast and radio show. So excited today. My friend Robin FARMANFARMAIAN has joined me on the podcast. Robin and I have known each other for a couple of years now, crossing paths, because we're both on a mission to make healthcare more affordable and to disrupt healthcare. And if I had to have a top 10 of people who I know who've truly disrupted healthcare, not people who just talk about doing it online, Robin would definitely be in there. Fascinating person, fascinating personal story. So Robin, before we get into your book, I don't know anybody else who's ever married a prince. So can you tell us just a little bit about, first of all, start with your maiden name, because I know I've seen that a little bit online, but also where people can find you and your personal story on social media.
Sure. So I am Robin Starbuck FARMANFARMAIAN, but I was born Robin Starbuck Soloway. And back in, I want to say 1999, I met a Persian prince from the Qajar dynasty and ended up having about a 10-year relationship with him. We were married. And it's been about 10 years, so don't try and do the math since we've been separated.
So, Robin, you wrote a book called The Patient as CEO, and folks who listen to Health Wealth podcast, we call them the Health Wealth Nation, know that on almost every episode I talk about them becoming an EHC, an engaged healthcare consumer. There is no bigger example of becoming an EHC than Robin. Long before I met her, she wrote a book entitled it The Patient as CEO. That's the ultimate EHC. So show us your book and then tell us about what we can expect if we read The Patient as CEO.
Absolutely. So this is really about the convergence now of all of these fast-moving technologies coming together and not only dramatically changing medicine over the next 5 to 10 years, but really allowing patients to be in the driver's seat, have a lot of information, and have control over their own destiny in the world of healthcare. Everything from artificial intelligence to robotics, sensors, 3D printing, and even being able to utilize and tap into the power of the crowd.
So you can tell that Robin is entrepreneurial. You'd probably guess she lives up near Silicon Valley. Robin, personalize this to where the flame went from just a little flicker with you as the patient to, wow, I'm seeing things differently, and I'm gonna change my life, and I'm gonna actually go in a direction where I can disrupt healthcare from that hospital bed forward.
Yeah, I mean, and it was essentially from the hospital bed. So at 16, I was misdiagnosed with an autoimmune disease. By 19, they'd taken out my entire large intestine in a series of 5 surgeries my freshman year of college. By 26, they had me on 80 milligrams a day of methadone and told me I was cured. So I essentially told them absolutely not. I fired my entire healthcare team, took control of my own healthcare destiny, started taking myself off of high-dose opiates, which is essentially, heroin withdrawal. And I ended up getting diagnosed correctly, put on a medication called Remicade, and literally went into remission overnight. And at that point, it had been a 13-year misdiagnosis, 43 hospitalizations, 6 major surgeries, and 3 organs removed.
A case study in the fee-for-service, free-for-all, that was the reimbursement methodology in the 80s, 90s, even back to the 70s, but until pre-Obamacare. So how old were you when you fired your whole medical team? Were you about 26? Is that what you said?
I was 26 years old.
When you became the ultimate EHC, I love that. And so what Robin learned early in her life is not only does she have the ability to ask for a second opinion, but to become engaged in the process, just like you would when you buy a house or a car. And it's so ironic that in America, people feel awkward asking their doctor for a second opinion. Because, and one of the other things we talk about in the Health Wealth Nation is the 6 words that killed American healthcare are your insurance will pay for it. Because it gives us that mentality, right?
Yep.
That, oh, it's not costing us. And so then we feel guilty asking for a second opinion. So Robin, tell us what that was like, building up the courage to say, look, you might be a doctor, but I'm going to go in a different direction. How'd that go?
For the most part, I just walked away from all of my doctors without even telling them and found new ones. There were a couple that were difficult with, which was actually kind of funny because, like my gynecologist, I was just literally switching out my entire team. I had no GYN problems. All of my problems are GI related, and the practice wouldn't let me. I was like, I want to have a different doctor inside that same practice, and they said, no, you're not allowed to do that. And I'm like, excuse me? And they said, well, is there something wrong with him? And I go, no, I am switching out my whole care team. If you don't want to give me to another doctor on that particular provider, then I'm just going to go to another hospital. And they eventually let me see another gynecologist inside the practice.
Well, it's interesting because one of the other stories I tell when I speak and in the book is about how if you ask for pricing from that same person that was so kind to you and you said, hey, I just want to switch doctors, and she said, what's wrong with you? I mean, of course you can't do that. This is America. We're in charge, not you. It's the same as if you go to the hospital and ask for prices, right? They look at you like, why would we have prices? We're the only business in America that you can't know how much you're paying before you actually consume the goods, right? So this is why I'm always so fascinated listening to Robin, and she really is that 1% that not only lived this story, but just when you see her speak, has that gift to deliver and entertain and make you laugh also while making you almost cry to hear what she went through. So Robin, in this process, tell me about healthcare affordability and spending, because when you did engage and become that EHC that's an Fire and the whole team, that could have been very expensive, but I'm sure you were conscious about the cost of it. So tell us what you learned that you would share with other people that are looking to become engaged healthcare consumers.
Sure. So I just use the mentality of hack everything. So I was at one of these major academic hospital systems, and my insurance company dropped them and didn't tell me, and the hospital didn't tell me, and I got 2 Remicade treatments that equaled about $50,000. And all of a sudden I found out I wasn't covered for 4 months, and nobody told me. And this was a major blue and a major academic hospital. So I, by the way, switched out that hospital because I just left that insurance company. I left that hospital, got a new one. And I managed to figure out a way to hack it because I'm like, why is my Remicade $50,000 for 2 treatments and I'm getting this 8 times a year? That is insane. So I found an in-home full-service pharmacy, and they do it for $10,000. So my bill, or my insurance company's bill, went from literally $28,000 to $10,000 just by hacking it. So I use a company called Crescent Healthcare, but there's plenty of full-service pharmacies. I found a physician who would prescribe it to me to have it done in the home. And not only did that change dramatically save myself my copay, because my copay went down by about half, my insurance company's bill went down by about 2/3, but my recovery time went from a week to 3 days, just by changing the patient experience.
By becoming an EHC, I love it. So Robin, that was a few years ago, and nowadays one of the first things people would probably tell you is, hey, you should get a genetic test or DNA to see if that medication actually works. Tell us, if you're willing to, have you done that personally, knowing your history, and if so, what are your thoughts on knowing your genetic makeup?
So I am an entrepreneur through and through. Back in 2005, I worked in consumer-facing genetic testing, the very first consumer-facing genetic testing company. So yes, I have my genome absolutely mapped, but I think it's still really early. So while we can potentially determine things like cholesterol drugs, like based on your genomics, we can't test things like Remicade yet. We just don't have enough data. Over the next 5 to 10 years, we will, and that is rapidly exploding. In fact, the figures just came out. 12 million people worldwide now have had their DNA sequenced. And the vast, and it's on a massive exponential trend because there's about 3 million of that was in the past 3 months.
So you just heard Robin talk about DNA testing, and I'm going to hold my book up here. Most of you have seen it before, but it's Health Wealth from Forbes Books. Is healthcare bankrupting your business? 9 steps to financial recovery. And I want to talk about the 9 steps because one of them is DNA testing. And Robin, one of the things I did in my book is I said, hey, as an employer, because this is written for employers, after 1 year on the job, I want you to reward your employee by saying, we'll pay for your full genome sequence. We'll pay the $1,000. And I always joke, and don't give me that old baby boomer Gen X excuse of I don't want my employer knowing about me. Well, guess what? There's a federal law called HIPAA. They're not allowed to. So you're okay. You're safe there. But that's really the recommendation is pay for this. And we also ask employers, challenge them to pay for an integrative medicine consult or a naturopathic medicine consult. Those are 2 of the steps you'll find in here. But it's the third, one of the other steps, artificial intelligence and machine learning, that you just heard Robin very eloquently weave in, because in Silicon Valley it's just assumed that yes, we're learning every second and every day from every bit of data that comes. And really there's a couple of projects that we've talked about nationwide that are DNA AI projects. There's one in Reno, Nevada going on with Dr. Tony Slonim, who's been on the show, in Renown Health, partnering with Helix. and the Desert Research Institute to voluntarily let people opt in, do DNA testing. They're using the AI to get better. And so I wanted to make sure we clarified, same thing back at Geisinger, back there. So there's these tests all over the country and these projects, but what Robin said is important. She said it's important that we get our DNA tested. It is real science and it doesn't work, but really it's true AI because we're learning as we go. And she gave a great example of in some areas we're already there, and the quickest way for us to get to those other areas, and Robin talked about her autoimmune disease where years ago there wasn't a whole lot of data. The quickest way for us to learn that is for people to continue to volunteer to get DNA testing and genome sequencing and to participate in these projects. So Robin, I know you have your hands in at least 4 different kind of disruptive healthcare products and services right now. Can you tell us about a couple of them?
Sure. So I just invested in an inhaled insulin liquid formulary with a smart connected device. So you can imagine that working with a continuous glucose meter, and then the doctor being able to get data on exactly how much insulin they got and never having to stick yourself with a needle. Another company that I'm working for as vice president is Actavalon, curing cancer by repairing the p53 part of the human cell. We also have a prodrug for breast cancer, and we're early stage mouse trials. I'm working on a disruptive device for sleep apnea, which is an $11 billion market. And I'm an advisor on MindMaze, which is a $2 billion unicorn using virtual reality for stroke and brain injury rehabilitation.
Can we go back to the sleep apnea thing? Because there was a brief time in my life where I'd gained some weight and I had to wear one of these masks. So is the technology you're working on for sleep apnea, am I still going to look like a stormtrooper while I'm sleeping?
Well, we're completely stealth, so I'm not allowed to talk about it, but it is a very different way of looking at treating the condition than the CPAP.
Okay, so it might be a modified stormtrooper helmet, but not the same one. So we'll see. I'll speculate there. So, okay, cool. So, Robin, tell us about, it's interesting. So we're here February 2018. We're doing this taping, and I read the other day, Silicon Valley's kind of an investment community is really surprised that these disruptive healthcare technologies, they swear they work, but why aren't there more IPOs and why isn't there more revenue coming in? And folks like Robin and I go, well, nobody asked us. We could have told you that there's not many buyers in this market. You don't get into this market until you know who's going to buy. And I think my early learning process was people wanted to sell to the hospital right after Obamacare, and I went, wait a minute. You think this unit that once was this huge revenue generating beast that's now been told in the future model you're just the largest expense in the system? Why would they spend a penny on anything at this point? Because the bigger business in healthcare is now going to be the health system, the ACO, the insurer that's being morphed into all of them. So tell us what you've learned, Robin, as an angel investor, as a disruptor, because I know you get 3 or 4 of these calls a day. I only get 1 or 2 a day. I know you get 3 or 4 about, I have this great idea, it's going to disrupt healthcare, and we go, no, it's not going to disrupt healthcare.
Right.
But so tell us about how and why you know what will work.
Because you really need to understand healthcare as from a global viewpoint. This is a $3 trillion industry. Anyone who says they're going to disrupt the healthcare industry, no, they're not. They're not going to disrupt the entire industry, right? We know they're going to disrupt a disease state or a portion of it. That's very, very important. So you need to understand where you can plug in, because you can't go to some of these big systems like the Veterans Administration, Kaiser Permanente, or United Healthcare and say, look at this fantastic device, if there's no way that they have it in their workflow already. You need to solve an existing problem for one of the big guys that could potentially give you money. Who's going to pay you for this? Are there predicates? Are there competitors, right? Are there companies that might be giant companies who already have cornered the market and yours is just a slight improvement, or is it actually really disruptive? So I look at, are they solving that existing problem, or are they making one up? And if they're making one up, healthcare is not going to adopt it very quickly.
I love having this conversation with other people in the know that have been there and walked the walk, because so many times people give me an idea and you can hear the excitement in their voice, and you let them talk for 10 minutes and then you got to manage your time. So you go, hey, can I interrupt real quick? So let me tell you about the 3 others that have called me doing the exact same thing. And they go, what? Right. Nobody's doing what I'm doing. Yes, they are doing it, but what I usually go to is what Robin said, a couple things that I always start with. So if you're an entrepreneur and if you want to disrupt, let me just list off 3 or 4 things that she just threw in there that are really critical. You're not going to disrupt an entire industry. Disrupt a problem. Disrupt a manner in which a solution, a singular solution is provided. And understand that you don't have to be first to market. You can take who's first to market and you can adapt it to the problem you see not being solved. And that's very important. But here's another thing in healthcare. If you don't have one client, you really don't have a product at all. And the only thing harder than getting your first client is getting 2, 3, and 4. And I love it when a quote unquote potential disruptor comes to me and they've got 4 clients, because 3 or 4 seems to be the number where you go, okay, people are buying in. Because everything's homegrown. You know, Robin's got friends at this hospital. I got friends at a different hospital. We can sell them in on this, but getting another hospital where you don't have a relationship or a provider to do it is a whole different story. It's a sales process. It requires skills. So the one thing I always say to folks is, and Robin, I want you to chime in on this, is don't go tell me how you're going to solve my problem without at least asking me first what my problem is. And the other thing that drives me nuts, and I got a lot of traction on one post on LinkedIn where I said, don't tell me your solution without asking the problem, but also stop doing R&D on a product that has no client. Get a client with a problem and solve it. So talk about that and your experience with that.
So absolutely. Anything that I start delving into, we make sure that there is an existing reason for it, right? So things like the inhaled insulin company, to me that was almost a no-brainer to invest in, right? I knew right away this was a company I wanted to invest in. Then I met with the founders and they have 30 years of experience in big pharma. First and foremost, if you are investing in a pharmaceutical company and there aren't people on at least the board, if not full-time at that early stage pharma company that have not already spent half a career at least in big pharma, they're probably going to fail, because you need to plug into very big existing systems, but also rules and regulations, and you need people on that team. So those are some of the big things that I first think about with that.
So let's take that subject and so a couple weeks ago, Intermountain, it was actually January 18th because it's the same day my book launched. It was a big announcement. And the timing of my book's been awesome. I mean, since then, what's happened? On January 18th, Intermountain, Ascension, like 5 other health systems announced they're going to start their own generic pharmaceutical company. A week later, Apple launched. They're partnering with 12 health systems to put their EMR in your hand. A week later, Amazon, Berkshire Hathaway, JP Morgan said, we're blowing up the whole delivery model. We're starting over, which essentially what the first chapter of my book is about. Hey, let's just blow this up and start over. A week after that, Disney in Orlando says, hey, we can't do this anymore. We're going to start over. You know, I'm from Orange County. It's only a matter of time before Disney in Anaheim and Burbank says, hey, we're starting over too. So all these things have happened. This is truly the year where healthcare affordability, we have truly reached our tipping point. I love that because that's the first paragraph of my book. When are you going to reach your tipping point that you can no longer afford healthcare for your employees? So that first announcement I made, or I mentioned, Robin, January 18th, a bunch of good national health systems that are actually the good players trying to do the right things, if there are any out there in the hospital sector, said, hey, we can't afford to keep paying pharmaceutical companies that aren't acting responsibly.
Right.
And so we're going to start a generic drug company. And in the industry, people are saying they just started a huge war. So tell us your opinion on, is Big Pharma going to let that happen? Because there's nobody better at working behind the scenes to kind of throw things under the bus than Big Pharma.
So I wouldn't worry. I don't think Big Pharma is worried about generics, right? There are a few big pharma companies that actually do a significant number of generics, but that means it's already off patent for them, and they're no longer making the billions of dollars on it anyway, right? And then there are so many different ways that Big Pharma can innovate and start to reactivate some of those expired patents. For instance, take Otsuka Pharma's Abilify. This is the second largest grossing drug in history at $10 billion a year. Just came off patent a few years ago. This is one of their blockbusters, right? That's a big deal. Sure. It's for schizophrenia, bipolar, those kinds of things. They just got FDA approval with the Proteus sensor. Now, what that is a sensor that is put on the Abilify tablet. When the patient swallows the sensor and the drug together, it's recorded, and the physician or the care team or even just the patient has a record that they swallowed this pill. Now, what that means for Otsuka Pharma is they've just extended their patent. And so these new generic companies are not going to be able to get the Abilify and put a Proteus sensor on it, right? They need to actually go through FDA approval for something like that, so it's going to take a while because this is a new technology. The other type of thing that big pharma can look at is reformulating their drugs. So a reformulation of your existing drug means you extend your patent. So things like, there's one that's now 3D printed. So it's just a drug for a seizure disorder, but now because it's 3D printed, it's a changed formulary and they can continue to make money on it. And a generic cannot do that formulary with the 3D printing until that comes off patent. And why that's so important, the 3D printing part, is because with this particular drug for seizure disorder, it makes it easier to swallow and dissolve because it's very difficult sometimes for patients with seizure disorder to swallow. So they're just two examples of technology allowing big pharma to dramatically counteract anything about the world of generics. I'm not worried about that for them.
It's taken me back to my hospital CEO days. You could always tell when what drug the big pharma was pushing before the patent ended, because all of a sudden all the psychiatrists would start writing orders and say, this is so much better than that. And it was just like clockwork. So my guest on the Health Wealth podcast and radio show today is Robin FARMANFARMAIAN. She's the author of the book called The Patient as CEO. Great book if you haven't read it. You can find Robin on LinkedIn, but also on Twitter at RobinFF3. That's ROBIN, F as in Fred, F as in Fred, the number 3. And Robin and I sometimes will have fun going back and forth on Twitter just with healthcare affordability and disruptive type messages. And she's been a good friend for a couple of years. And if you're looking for a speaker, in fact, why don't you hire us as a 1-2 combo? Robin and I are a great combination, awesome, speaking from the same stage, because we really come from different angles. We bring different, we both bring a ton of enthusiasm, but I always enjoy speaking at events where Robin's there because she brings that same level of high energy and enthusiasm, and really a truth teller like myself about the elephant in the room. Look, we're just going to talk straight here. I'm going to help you understand what needs to be done. And nobody's got a better personal story about being the patient than Robin. So check her out on social media. Robin, let me ask you, put you on the spot a little bit. If one of your friends calls you and says, Robin, I haven't been working for a couple of years. I need to get a healthcare policy. I can't afford healthcare. You're the expert. And when we work in healthcare, we always get those kind of calls, right? So let's just go back to the consumer, the American consumer who can't afford healthcare. I mean, you and I who've been blessed to be, financially successful, even for us, it's very expensive and we want to complain too. So how does the average American justify, and what would you tell them to help control those costs?
Sure. First and foremost, do not ever go to the ER unless you are actively bleeding, have had a heart attack, or are unconscious for reasons that you are not aware of, right? You do not go through the ER. That is literally half an hour in there can sometimes cost you $10,000. And there are many ways to hack it now. Doctors on demand are things like virtual care, right? You can see a doctor right away, right then and there on video, usually about $50, right, out of pocket versus $10,000. There are companies like One Medical and Forward here in San Francisco, which is a subscription fee, and you have access to your primary care doctor almost on demand, same day or next day appointments, right? And they have laboratories in their offices. There are a huge number of point-of-care diagnostic devices that you can buy for under $200, like stethoscopes that plug into your smartphone and analyze the data. CellScope plugs into your smartphone and analyzes your ear data. So if your kids have a lot of earaches at 2 in the morning on a Saturday night, instead of going to the ER, instead you just use the CellScope.
Cool. So I don't know if the listeners can hear, but somebody else is calling in on my Skype, and I'm going to ignore that for a few minutes. But I just have one more question for Robin. If I can ignore this, let me see if I can.
Technology.
Okay. Technology. We'll cut that part out if we can. So Robin, I always like to wrap up the show with a question, a really difficult question to answer because I'm such a huge sports fan. So whether it's pro or college, what is your favorite sports team to root for and why?
The Bruins, because I played competitive varsity ice hockey for Boston University and Lawrence Academy and Kimball Union Academy for 6 years. I was frontline center. And I'm from Boston originally, New Hampshire. So
Who
Boston
knew?
Bruins ice hockey.
I didn't know you were a hockey player or that you were a Northeastern. So my guest on the Health Wealth podcast and radio show today has been Robin FARMANFARMAIAN. She married a prince. If nothing else, you've never met anybody else that married a prince, but she also wrote the ultimate book on becoming an EHC, The Patient as CEO. So guys, join me in thanking Robin for joining the show, and tune in next time to the Health Wealth podcast and radio show with Dr. Josh Luke. Thanks, Robin.
Thank you.